Good morning. I would like to welcome Dr. Kumarasamy, who's the Chief and Director of VHS Infectious Diseases Medical Center, Director of the Chennai Antiviral Research and Treatment Clinical Research Site, Head of the Department of the VHS COVID-19 Treatment and Vaccination Center at Voluntary Health Services. Dr. Kumarasamy is a clinician and a researcher in infectious diseases with more than 25 years of experience, and he's published more than 400 manuscripts in peer-reviewed medical journals. He has conducted several landmark antiretroviral clinical trials, which has impacted treatment guidelines. His publications on the impact of antiretroviral therapy has led to several antiretroviral scale-up programs in developing countries. He's an advisor and expert panel member for the World Health Organization, ARV Treatment Guidelines Committee, and a clinical advisor to the Clinton Health Access Initiative. Currently, he is the regional representative for Asia for ACTG NIH. He has a particular interest in the long-term impact of antiretroviral therapy in resource-limited settings. So welcome. I really want to thank you for speaking with me today. And I just wanted to start out by saying that last week, the Indian government announced that more than half of India's adult population had received at least one dose of the COVID-19 vaccine. So what exactly is the COVID situation in Asia and in particular in India at this time? Is it slowing down? How are things developing there right now?
The first cases in India has been diagnosed in Jan 2020 with one of those traveler, who was in fact a medical student from one of those medical schools in Wuhan in China, who came to who traveled to India. That was the first case, and in the next couple of months, there are several case reports start coming from different parts of India, and by March last week, the cases started increasing, and since then we have already seen two huge waves of surge in cases, and till yesterday, more than 33 million people being infected, and affected with COVID, and we had around 440,000 deaths so far in India. Wow. And we have been seeing a daily death of around 450 to 500 currently. But a couple of months back, we were seeing around 1,000 to 2,000 deaths a day. So this is something, the magnitude of this COVID disease currently in India. I think to your question on vaccination, in India, we have 3 different vaccines available, and out of those, 2 of them being used a lot. We have a vaccine called Covishield, which has been indigenously developed, which is an AstraZeneca vaccine, but developed in India at the Serum Institute. We have another vaccine called Covaxin, which is a killed viral vaccine, developed again by an Indian company called Bharat Biotech. These are the 2 vaccines maximum being used in India. Also, we have a third vaccine available, which is a Russian Sputnik vaccine in very small numbers. But there are several other vaccines developed in India in the pipeline, and recently been approved for emergency authorization by the Indian Drug Control of India. So this vaccination drive started in India since January 16, 2021, initially with the healthcare workers, then among people with 60 plus, then 45 plus, then now everyone more than 18 years are eligible to receive vaccination. So in India, around 685 million people so far have received vaccines, and out of those, 525 million have received the first dose. That is around 38.4% of the eligible adult population have received the first dose of vaccine, and 159,000 have received both the doses. That is around 11.7% of the eligible population. I think to your question, here we have only around 11.7% of the eligible population, that is 18 plus, have received both the doses. So it's still a very long way to go. And now the second wave has been dipping in India, and all our restrictions and lockdowns imposed by the government has been lifted, and now the whole country is going back to normalcy, and schools are reopened, and we fear there could be another third wave, and there could be a surge in new infections.
Of course. And have you guys had issues with people not wanting to take the vaccine, or with vaccine uptake in terms of misinformation campaigns and those types of problems that we've seen in the United States and a lot of other places around the world?
Right, and of course, we do have vaccine hesitancy here in India, but our government has been doing several health information messages to the public. Also, the physicians group and hospitals, they're also doing various messages to the public, and several other social service organizations have been involved in getting people to get vaccinated. But again, the issue being in India is we sometimes run out of vaccine shot, despite it's being developed in India. That is because you need huge numbers. If you want to vaccinate all the 1.3 billion people, it's not possible. We can't do it. It may take several months. I think our 11.7% being vaccinated with 2 doses is because of the huge population. Our denominator is huge.
So what about people living with HIV? How are they being impacted by COVID?
So I think during this COVID lockdown, which has been imposed since March 2020, several of our patients with HIV, they couldn't come to the clinic to see the doctors, they couldn't come to the pharmacy to collect medications. So there are several reports stating that they ran out of medications. It definitely disrupted their regular continuum of care. At our hospital, at Voluntary Health Services here in Chennai, where we have registered more than 20,000 people living with HIV, and we provide follow-up care. So we developed various strategies during this lockdown. We offered teleconsultation, video consultations with their consent, and also we used several other mechanisms to send medication to their homes. We have a very efficient courier mechanism here in India. During even this lockdown, some of the couriers have been functioning. And also we have in India, historically, excellent postal services, which was been built by the British very long back. As one of those they left to us, which has been working extremely well. We use that postal services to ship these antiretroviral medication to patients' homes. There are various ways where we, we're able to get this medication to patients, but still there are a significant number of people had disrupted their antiretroviral therapy. At our hospital, we provide follow-up care to people living with HIV, even with COVID also, because our hospital is one of the largest tertiary referral hospital for COVID treatment, where we managed more than 3,000 people with COVID. And out of those are 150 were both COVID and HIV. So very few mortality we saw in the HIV infected people, and people who died, there's a very small numbers, around 10 to 12. They were either not on antiretroviral therapy, or they also had other multiple comorbidities like severe diabetes and hypertension. So we found it from our own experience that HIV itself is not a risk factor if they are taking this antiretroviral therapy. I think on this, we clearly did counseling to all our people living with HIV. Take your antiretroviral drugs regularly, and it's very, very important, even in the COVID pandemic, very, very important. And also we did counseling stating that if they have any other comorbidity like diabetes and hypertension, they should adhere to those medicines, along with other public health messages like masking, physical distancing, and hand washing.
Right. And what about vaccine? Have you been vaccinating people who are HIV positive?
Yes. I think that the government of India, when they started vaccination to the public since March first week of 2021, we initiated vaccination to our patients who have been living with HIV. We have used both the Covishield and as well as Covaxin. We have not found any untoward adverse events. We also have done antibody testing on them. We have seen them, they have developed antibodies following this vaccination. We have been closely following our cohort of people living with HIV. So now most of them have received 1 dose and a few of them have 2 doses. We're also monitoring and studying them if they need any additional doses and following the recommendation by the US CDC that should also receive a booster. We are closely monitoring our own patient cohort if they need another booster dose.
Okay, that's great. So there's a scientific side to this also. So how has COVID affected your work as a scientist in terms of your research and so forth? Are you merging your work in HIV with your work on COVID, or how is that working?
We continue to provide services for our HIV infected people. Even in this pandemic, our clinics and hospitals are open to them. But since there's a lot of restrictions and lockdown, patients are not able to come to the hospitals for their regular follow-up. But on the other hand, all our team, including myself, my other clinicians and other healthcare workers, nurses, and everywhere, we've been involved in COVID care in the hospital in the last 1.5 years. That's our major work in this pandemic, because we have been taking care of a very large number of people who have been infected with COVID.
Okay. So what do you think are the most immediate issues and challenges that need to be addressed at the intersection of HIV and COVID?
So I think it's very important to provide the uninterrupted services to people living with HIV, in this pandemic. So we never know that how many more surges of this COVID infection we are going to see that, and there could be more and more lockdowns. I think our program should develop plans how we can provide these multi-month, prescriptions of antiretroviral drugs to our patient, not just every month refilling or every 3 months. Beyond that, something we develop plans which we have been working on, and we are also been working closely with our national program how they can implement such multi-month model dosing. Prescribing antiretroviral to our patients, and also you also need to develop counseling plans to be in regular touch with them through telephones or any other online forums. I think that's something is very important, which we have already implemented in our clinics, and we have been working with our other fellow clinicians and the hospitals how it can be implemented widely across India.
And these sound like things that would actually improve healthcare in general anyway, outside of the context of the COVID situation. So going forward, if you can get those kinds of strategies in place, then they would maybe reduce some of the burden for people who are living with HIV going forward to not need to come in for as many appointments, get to the pharmacy as often, and so on and so forth. So maybe there's a silver lining to all of this in terms of changes in the structure of how we are treating people with HIV. Is that true? Does that ring true? Or
so one thing in this pandemic, we learned by offering clinical care to people with COVID, how difficult such a disease to be managed. So after seeing that, whatever we have been doing in HIV is not that difficult, because and HIV used to be a killer disease before antiretroviral. But now with all those, people living with HIV, if they have access to antiretroviral therapy, it's purely a chronic manageable disease. It's nowhere near the COVID disease what we saw here. And having said this, now this is time that to carry out research, particularly in HIV infected people in the context of COVID, whether COVID virus SARS-CoV-2 accelerate HIV disease progression. Do we need to do something different to our HIV infected people in the context of pandemic? And we have a prevention tool that's vaccines. vaccines, what we have been doing, is it the right one for HIV infected people, or we need to have multiple doses, or we need to have different vaccines? And coming to these antiretroviral drugs, currently what we have been prescribing to our patients, there are data shows that they are not protecting COVID virus, and also they're not treating COVID virus. But on the other hand, when we have been treating COVID, is it the right antiretroviral VQ or something different? I think these are some of those researches we need to do. And also many of our patients, they live longer, and also when they develop a COVID in their lifetime, they also developing other non-communicable diseases because of the inflammation being developed by COVID in HIV infected people. I think various research we need to think at this time in this pandemic among people living with HIV, which will be translated to the clinical practice when we manage people living with HIV in the context of pandemic.
So, are you saying that people who are HIV positive who also get COVID don't really have a different long-term, long COVID outlook from your perspective than people who don't have HIV?
So at our hospital, we also have a post-COVID clinic to manage people with the long COVID. So we have set up a post-COVID clinic. So people living with HIV who develop COVID also attend in the clinic. So currently we see a similar symptoms like what non-HIV people develop that. And also in the post-COVID clinic, we also assess various other non-communicable diseases in people living with HIV. So we do very detailed examinations and rule out diabetes and any other cardiac disease or worsening of any of their pre-existing non-communicable diseases. All those I think we need to provide some sort of continuum of care even in the context of COVID and as well as in the post-COVID.
Okay. So last question is, when you think about the HIV pandemic, if you want to call it that, and the COVID pandemic, are there some things that you see that are parallel or things that have happened in the COVID pandemic that remind you of the early HIV situation, things that we could have done a little bit differently if we had drawn lessons from what we learned during the rise of HIV? What are your thoughts about sort of the then and now of HIV versus COVID?
So I think I will say that, offering HIV care was a huge learning for us now currently in the context of COVID care. So our hospital is one of those very large tertiary care hospital for HIV since last 25 years. And we learned so much by providing, starting from infection control practices, universal precaution, how to manage stigma, and along with that, how to introduce antiretroviral therapy. Now, whatever we did and learned from providing HIV care, we were able to use this now very easily and quickly adapted when we did in COVID care, especially on infection control practices. And as well as there were a lot of stigma among the COVID patients, where people were disowning them, it's a huge stigma everywhere. So, I think our whole HIV care providers, hospital, we jumped in very quickly and we are able to solve this. And our Voluntary Health Services Hospital is one of those leading COVID care hospital in our city of Chennai.
Okay. All right. Is there anything else you would like to add? Anything else you'd like to say about the issue of HIV and COVID?
I think from a country like India, where we have a huge population, we have 1.3 billion next to China, our density of population is very huge as compared to many of those developed world. Again, being an infectious disease doctor, so here this is COVID being a very easily transmissible disease, we may continue to see more and more infections among our people. And also we have started seeing people reinfection. That is, people who have been infected with COVID previous year, again being infected. And also we have been seeing these infections among people who received 2 vaccines. So I think this is time that countries like India, where with such huge population, we need to develop appropriate preventive measures in the context of COVID on an ongoing way to protect our people, living with HIV.
Okay. All right. Well, thank you so much. I really appreciate your time, and it was very interesting to hear what you had to say about the situation with HIV and with COVID, especially in India. Thanks so much.
Thank you very much. Thank you.